do we offer aspiration of fluid? A little bit vague that, if you don't mind me saying. Do we offer aspiration of fluid? What, fluid on the brain? Fluid on the lung? I mean, depends where it is, depends where the fluid is. So the classic area, I guess, is a tummy tuck, which will be a seroma, which is kind of fluid that collects in the space where, you know, they've done the tummy tuck. And that's a relatively, maybe not common, but, you know, not uncommon. Is that the same as common? I guess it is, strictly speaking, but sounds a bit kind of less common than common. So I'm going to say not uncommon. It's not uncommon to have fluid collection in a seroma following an abdominoplasty, and we do aspirate the fluid on our patients. I don't really see other patients. I only really treat my own patients. So if you are a patient of mine, and you have a seroma, then I'd be very happy to aspirate it. I've got to be honest, I don't want to big myself up, but it's very rare in my practice. I've only had a couple in my life, basically, so it's very rare. But I do use drains, and that's one of the main reasons I do still use drains. It's a bit of a contentious issue in terms of tummy tucks. A lot of people are not using drains, and I do now do quilting, which has reduced the drainage, so I'm thinking about maybe moving away. But anyway, to be honest, I'm not used to doing that many tummy tucks these days anyway. So yeah, point is, if you have a seroma, then we would be very happy to aspirate it for you. But if you are, so that this question suggests you're not one of our patients, because you wouldn't say, do we offer aspiration of fluid? It suggests you kind of got a seroma. So what I would say is that's kind of like the responsibility of the operating surgeon / clinic. So they should really look after you, because the way it works is that you kind of pay a fixed price for the whole package. You can't really get aftercare as a separate like add-on. So if you have surgery elsewhere and you want to be looked after post-operatively by a different practitioner, I would imagine it's quite hard to find someone to take you on, and certainly I won't take you on. I kind of look after my own patients. It's just the way the industry is set. We don't really have kind of prices for instance, aspiration of seroma. There's no price for that, because that is free or for our patients. You don't charge for that sort of stuff when someone has a seroma. That would all be included as part of the service. So if you have a seroma, I would say go back to your surgeon / clinic, and they should be able to look after you for free. It's not really something that I don't think anyone, I don't know, I don't want to talk for other people, but it's not really traditionally charged for. It's a part of the looking after, because the other thing about seromas is you often have to repeat it. If you do get a seroma, you often have to repeat it, because you aspirate it and it can kind of come back, but it comes back, so it's something that's an ongoing thing often. So yeah, they can be a bit of a nuisance, seromas. Usually not a disaster, but they can be a nuisance. So yeah, as I say, we do it, but not on patients of other clinics.